Hi, I'm Dr. Shurov, neuroscientist, nutrition and health coach. And as a part of the STAR project, which stands for Support Team for Autism Recovery, we continue our series of interviews with different professionals who successfully work with children with autism using different techniques and methods. Today, I've got pleasure to have a chat with Paul Baptie, who is an autism therapist and also Handle technique practitioner and instructor. Paul is based in Czech Republic, but successfully helping children around the whole Europe. And also in a note under this video, you will be able to see contact details of Swiss-based Handle technique practitioner if you would like to arrange further consultation regarding this technique and particular your case, your child. Handle, it's actually a very interesting method. It's a movement-based cognitive therapy and based on our brain to be plastic. It's about neuroplasticity and about ability of brain to adapt and change as a response to very repetitive stimulation. Sounds very interesting, and I'm sure it can be very helpful to many children with the different neurological conditions. Let's find out more, and without further ado, I invite you to meet Paul Baptie. Let's go. Hello everyone, thank you for participating and watching this video. And today I'm talking with Paul Baptie, who is an autism therapist and also a practitioner and educator and instructor for Handle technique. But maybe just to start with, you can talk a little bit about yourself and how you became to know these methods and became a practitioner.
Irina, it's really great to be here, so thank you for inviting me. I'm English, and I was living in England, and I was a secondary school teacher. And I must confess, I was a little frustrated by how limited it was to help children. I could see many children in school, they were stressed, they were finding it difficult to cope with the learning. Lots of their behavior was difficult for them to feel really feel under control about, and most I could do was like offer help, encourage them to do their best and this kind of thing. And then what happened was I met this lady called Jana, who now has become my wife. She was working in London with a family who had a son with very severe autism. She was going away on all different training courses to learn different approaches. And one was the Handle approach. So fell in love with my wife, and I also fell in love with the Handle approach. We moved to the Czech Republic, with our base, where we live right now, and both of us just continue our learning and development with Handle, and we are open to other things. So you do a lot of work with diet, and we think that's really crucial for people. So I think the work that you do is great, and the more people can have like a combination of maybe working on toxins, maybe working on diet, maybe doing Handle, maybe doing like a play and working on their interaction with their child. All of these things I think are really helpful, really core to, helping your child make improvements.
Yeah, I think I really believe that not only one method can help child completely. So the combination and in the right way, combining different techniques and methods can make such a big difference and can be very powerful. Thank you for acknowledging the nutritional approach you like, because I'm also fan of that.
Yes.
But tell us a little bit about what is the Handle about, how it actually can help and support children with autism.
So Handle is based on the fact that the brain has plasticity. That the brain responds to whatever we're doing in life, what we're thinking, what we're feeling. What a lot of people know about Handle is that part of Handle is giving people like exercises or activities to do every day at home.
Yes.
And that these can help organize the nervous system.
Of course, yeah.
Help the body and brain connection work better for us.
Absolutely.
Usually these people find these really straightforward, really easy to learn. There might be some tapping, there might be some squeezing of the fingers, let's say. It might be a massage. It might be just a sequenced movement that would show the parents to do. Something rhythmic is often very helpful. And so we ask parents to do this. Typically it takes about 20 minutes to do a program each day. And then we ask them to do it like in the long term, like at least 6 months or a year, and potentially much longer than that.
Okay.
And other elements of Handle, the other half of Handle is really what we call the approach. It's the philosophy and how do we interact with the child, ways of playing with the child, ways of waiting for them to be in a good space, we say in English. So it's a good moment. Your child's not like closed in and everything, but they're looking at you, or they're smiling, or they're touching.
Kind of engaging child at the beginning, and when he's ready, you start to do this kind of set of small sort of elements, the techniques, the exercises, repeatedly you do every day. That's
right. So we are trying to fit all of the program to the child. We're trying to make it individual. We're trying to make it interesting for the child or fun. When we enjoy something and we're really paying attention, makes a big difference to helping us all like progress and make our brains work better for us, so that all the daily things, the sleeping, the eating, the dressing ourselves, the speaking, can become that much easier to learn.
So how does it work? So, for example, if a new family comes to you with a child, so do you do like an assessment? How do you start, and what the program looks like?
Exactly. So we do a lot of observational work. We give out a questionnaire to parents, and we ask lots of individual questions, but it's looking for like neurological information, if you like. I'm trying to understand which parts of the nervous system and so on are already working well for the child, and which areas need some more help and support. So I know, I need to maybe pick some activities that are going to be helping in this direction. And then I work with the child, and I'm really observing, how does the child do things? How much does the child engage with me? How much does the child have eye contact? How much the touch is a problem? Because
what is missing basically in all these sort of sensory systems, which needs to be balanced, but they
needs to be balanced. And on top of that, there's a very typical kind of pattern within normal development. So in other words, it's very normal that touch develops first. So if your child is having difficulties with accepting face washing or toothbrushing, kind of basic things that you would normally expect a youngster to be able to accept, it now becomes, your child's going to really struggle to learn if you're trying to teach them how to talk or how to do something, maybe even academic, when it's part of the basic foundation is still not in place.
Exactly. So I think this is absolutely great observation, because we sometimes, asking children to do too much when we're missing the very basic, simple things. So how long does it take this program before you really start to see progress from your experience? Of course, every case is different, but just on average, maybe 1 or 2 examples.
One time we had a family come and work with us from Slovakia because their son had autism. But they brought the whole family, and the daughter, she was a little bit older, had some difficulties with wetting the bed at night. And so we gave her, as it happens, just one activity, in fact, rather than a whole program, but one activity that can help her quite a lot. And about 5 weeks later, she stopped completely wetting the bed.
Okay.
So that kind of thing can happen. Another time, we were working with a family from Poland this time, and their son was he was not eating anything.
Okay.
The parents were both doctors. The parents were having to feed him like liquid nutritional drinks and so on.
Mm-hmm.
And we were giving a program that had a lot of help for feeling the body and for the sense of touch.
Mm-hmm.
Inside the mouth, this boy's touch was so sensitive, but lots of foods just felt so uncomfortable in the mouth.
Exactly.
So he had a very gentle program because, you know, it really needed to be very gentle for him. And bless the parents, they were very patient and they kept doing what I was asking them to do, even though it looked very simple exercises.
Mm-hmm.
About 9 to 10 months later, he was eating food.
Oh, wow.
He was putting on weight.
Wow.
He had a smile on his face.
Yeah, of course.
And the parents just felt so good.
This child probably returned like from different planet to sort of a more real world because he started to feel. But what is the program about? You shape it very individually, as you said. It's based on every special case, and the parents involved fully because you give instruction to parents who doing that set of exercise you develop every day with the child. Yes?
You've got it exactly right.
And how often do they go back to you or another professional
right.
for revising the situation, for further consultation?
Typically, we aim for somewhere like a month or somewhere between a month and 6 weeks to be in touch.
Just in case if somebody from Switzerland would like to contact you, say, Paul, you know, we've seen this interview, we would like to work with you. Yeah. That's possible, yes?
Sometimes, like one person, you know, I've worked a couple of times in Germany, for instance. Sometimes somebody from Italy wanted me to work, so I flew out to Italy to work with a family. It's possible.
Okay. Just nice to know how flexible we are in this with this method. Are you working primarily with the young children, or it doesn't matter at what age children can start the program?
It doesn't matter. Just sometimes we also work with adults, but my wife and I, we mainly see children who are hyperactive, who sometimes they have tics, but very often it's autism or a language delay or a general developmental delay.
So the main symptoms, improvements you seeing, you know, in your practice, what they are?
Okay, good question. So I said already that I think touch is really helpful to get that organized. So what we typically see is people start accepting hair washing. Maybe that sounds really basic, but they start accepting that because the touch gets more comfortable. Yeah. And now if they're more comfortable in their own bodies, it's so much easier to pay attention and learn from mommy or learn in school and so on.
Yeah.
So very often the child's own stress comes down. That's one of our big goals.
Yeah, stress, yeah.
Maybe brushing your teeth becomes easier. And that then helps the next learning of what you're doing with the mouth, so that very often they improve how much they talk. Or the whole brain-body connection is working better. So now their concentration is longer.
Improving, yeah.
In general, build more connections. In the brain, just to make learning easier and life more enjoyable and less hard work and so on.
Sounds very, you know, logical. For me, being a neuroscientist, I can see where it comes from and how actually observing these children, see how many little disconnections they have in the body. I think it's fantastic job what you do. Sorry, HANDLE stands what it stands for?
The H is for holistic approach to neurodevelopment and learning efficiency.
Wow, that's very good name. You know, it was a great chat, and I think it's a beginning, and I'm sure we will be able to wake some interest in parents to find out more and learn and maybe implement this great technique in their life. I will post all details how the people can contact you and other practitioners in Switzerland about the HANDLE. I would like to thank you very much for participating in this Autism Recovery project we initiated and run, and I'm sure lots of people can benefit from that. Thank you, Paul.
Thank you very much.